Okay, Amy. Can you tell me about what you've seen in the patient chart?
Okay, well, the patient chart reports that the patient was admitted to emergency yesterday, and the doctor's notes show the patient was admitted previously 10 years ago with pneumonia and has diabetes.
Okay. So, did you see anything else in the chart?
No, not that I can think of.
Okay. So, did you notice any investigations or anything that had been done?
Oh, I think a chest x-ray was done. We can probably have a look at that.
Yeah, we probably should. Okay. Did you notice anything else? I think there was an arterial blood gas or hematology result.
Yeah, okay.
Do you know why those might be important?
Well, the blood gas will tell us what the acid base is doing.
Yeah. Okay. And what about the hematology?
And the hematology will tell us about the hemoglobin.
Okay. Is there anything else that you can think of?
No, not off the top of my head.
Okay. Well, maybe we should go and have a look at the blood gas results, and we can work through those.
Okay, sounds good.
Okay, Amy. So we've got the arterial blood gas results here.
Mm-hmm.
Okay. So let's have a look at our oxygen first. So what do we think about her PaO2?
Well, it's 65, so that's pretty low.
Okay, so what's our normal range?
80 to 100?
Yeah, good. Okay, so yeah, like you said, 65 is low, good. So what about her pH? What can we say about that?
Well, her pH is only 7.3, so I'd say that's a little bit low as well.
Okay, so what are our normal ranges for our pH?
They're normally 7.35 to 7.45.
Okay, good. So what can we say about her pH? Is it acidotic, alkalotic?
Acidotic.
Okay, good. Okay, so let's move on a bit. What can we tell about her CO2?
CO2, well, that's pretty high.
Okay, good. So what are our normal ranges again?
35 to 41. 45.
Yeah, that's it. Good, good work. Okay, so we've got a high CO2. That's good. And what about her bicarbonate? What do we know what our normal range is there?
Normally between 22 and 26.
Okay, so it's 24, so...
Pretty normal.
Okay, good work. So what can we say about her acid-base balance here? What can we call it?
Would you call it respiratory acidosis?
Good. Okay, so we can see that her CO2 is high and that's affecting her pH and bringing that down.
Mm-hmm.
That's good, good. Okay, should we go and review the chest x-ray?
Yeah, let's do it.
Okay. So, Amy, we have the chest x-ray. What can you tell me about it?
There seems to be something in the bottom here. All the other areas don't look too bad.
Okay, so let's just take it back a little bit. Do we have the right patient?
Yeah, I think so.
Okay, all right, that's good. So we've checked that. So what about the orientation of the chest x-ray?
Well, it seems pretty good. I mean, I could see her clavicles and they all look well lined up.
Okay. And what about her lung fields and...
Yeah, I think everything's okay. Everything seems pretty good.
Okay, all right. Well, let's have a talk about the shadowing there. Okay. Do you know whereabouts it might be, whether it's in the middle lobe, lower lobe?
Well, I'm not exactly sure whether it's the middle or lower lobe because I could see both the heart and diaphragmatic borders.
Okay. So, looking at how the patient's admitted, what do you think might those things be?
I would say it's probably some sort of sputum retention.
Okay, right, good. Okay. Anything else that you want to tell me about the chest x-ray?
Not that I could see.
Okay. Did you want to go and have a look at the ALPS chart?
Yeah, that sounds good.
Okay, Amy. Had a look at the ALPS chart. What kind of things did you find?
Well, the patient seems to have a higher than normal heart rate and respiratory rate. Her blood pressure and temperature seem normal. She's on oxygen at the moment at 4 litres per minute with her saturations at 93%.
Okay. So what do you think all this is saying about her?
That she needs oxygen?
Okay, good. Okay, so what do you think they've done to rectify?
Oh, well, she's on oxygen.
Yeah? Okay. So what do you think the heart rate and respiratory rate are telling you?
That her heart rate and respiratory rate are higher than normal.
Yeah? Okay. So what do you think might be happening to cause that?
Well, her breathing's faster, so her heart has to work harder.
Yeah? Okay. Alright, so how do you think the patient might look with a higher respiratory rate?
She'd be more out of breath.
Yeah? Yeah? Okay. Anything else that you can tell me about the Elvis chart?
No, not that I could see.
Okay, alright. Well, let's go and have a look at the patient and then we'll go from there.
Okay. Hi, Mrs. Carter. My name's Amy. I'm a physiotherapy student. How are you doing today?
Hi Amy, call me Polly please. Yeah, I'm doing okay today. A bit better than yesterday.
Oh, well, that's good to hear. I see your chest has been playing up. How long's that been bothering you?
Oh, well, this time it's been about 6 days.
6 days? Okay, well, from your chart it says that this isn't the first time. Do you want to tell me about that?
Yeah, it's a bit of a long story.
Okay.
For about 1.5 years now. This is about the 6th time in 1.5 years.
Okay, wow. Were you admitted to hospital for the others?
No.
No?
No.
And how's your breathing been? Have you been feeling short of breath?
Yeah. Yeah.
Okay. So has that been since you've been feeling ill this time?
I'm always short of breath.
Always.
It's been like this for a while.
Yeah?
Yeah.
How was your breathing before this episode?
Well, I think this is the worst. I'm getting sick of it.
Yeah?
Mm.
How are you finding it when you're walking or doing other activity?
Well, before I could walk down the road, and now it's getting too hard.
Okay. Is there any time you cough most or more than others?
No, the cough is always there, but I guess it's more in the morning.
Yeah?
Yeah.
Were you coughing before you got sick this time?
Yeah, it's always there.
Okay. And have you been coughing anything up?
Well, this time it's green. Usually it's yellowish.
Okay. Have you been getting any pain anywhere?
Yeah.
Yeah.
Around my ribs, lower ribs.
Okay.
It's a bit painful.
Can you describe that for me?
It just really hurts.
That's okay. No problems. Is this your first time seeing a physio?
Yeah.
Yeah?
Yeah.
So you didn't see one last time you were admitted to hospital?
No.
With pneumonia?
No.
No? Okay, so who do you live with at home then?
I live with my husband and 4 children.
Okay. Any stairs at home?
There's 4 stairs at the back.
4 stairs.
Yeah.
Okay, and do you work?
I do volunteer at the shelter.
Okay. Okay, well, we'll see what we can do to help with that. I just wanted to check a couple of things with you, okay? It says in these notes that you've never smoked and that you have diabetes. Is that correct?
Yes, that's correct.
Okay, great. Okay, let's listen to your chest. Oh, Miss Carter, this is Tom. He's my educator.
Hello, Tom.
Hi, Miss Carter.
Do you mind if I listen to your chest?
No, that's fine.
Okay, good. Okay, so deep breaths, please. And keep going until I say stop. Okay, can I get you to move forward, please? There's not much I can hear.
Amy, are you happy with what you've
Yeah, I'm gonna have a feel of her breathing. So I just need to have a feel of your breathing now. So take some deep breaths for me, please. And again. Okay, deep breath. And big cough. Okay, so that was good. Okay, I want you to try and do that on your own.
A cough?
Yeah.
So how many times a day?
I guess a few times an hour.
Oh, okay.
Okay. So we're gonna get you up and walking now.
But I do feel a bit short of breath.
Yeah, I know, but look, walking's good for you, so we really need to do it, okay? So, let's go. Okay, so I'm gonna get you to sit on the edge of the bed, just so that we can prepare for walking. And Tom, can you come and assist me for the walking part of this?
Sure.
Holly, you know Tom.
Hi, Tom.
He's my educator. Okay, so I'm gonna unplug the oxygen. We should probably take that with us. Alright. Oh, I'll just go get some oxygen, actually.
Do you want to maybe plug the oxygen back in before you head off?
Oh, yeah. Probably should do that. Okay. I'll get the oxygen now. Okay. Okay, so we're ready to walk.
Whereabouts do you want me?
Do you want to just push this along
Yep.
and just make sure it's not in our way?
Sure.
Okay, I think we're ready.
Now, before we head off, sorry, Polly. Before we head off, are you happy with everything we have here?
Yeah. So that's plugged in and working, so yeah.
Okay. Do you think that we may need to monitor her while we walk?
Oh, yeah, what sort of monitor do you think I should get?
Well, I think we need to at least monitor her saturations, so...
Saturations, yeah. I'll just get one of those. Okay, I need your finger, Polly. Just clips on. Alright, great. Okay.
Okay, so what kind of things are we looking for when we go for a walk?
Well, she's been feeling short of breath, so we want to check that and check the saturations.
Okay, anything else?
Just make sure she doesn't trip over the cord.
Okay, okay.
Okay, let's go. Okay, Polly, so you comfortable? You've got everything you need?
Yes, thanks, Amy. Thanks for all your help.
Not a problem. So I'm going to head off, but I'll be back tomorrow.
Okay.
Might be a good idea to check with the nursing staff, see if they can get you up for a walk a bit later on, okay?
Okay, will do. Thank you.
I'll see you tomorrow.
Okay, bye-bye.
Bye.